capital M, Med Assist 3, exclamation point. Okay? You will have the login information for your competency, so you don't need to memorize that. Once you have your login, you're going to hit login. Now, you're just going to prop it up against the wall and wait. The provider also has their login information, and it looks like this is provider number 3. So the provider is going to be on this side. They're going to log in. Okay, provider number 3, and then the password. Just like so. Sign in. So now the provider is going to wait until the medical assistant has prepped the patient and found the patient and get him into the visit. So you're going to come over here. This says patient ID, and the patient was patient number 7. So they're put in here as curriculum training patient. So I'm just going to put patient. And then the number 7, space 7. So here it is, curriculum training patient 7, 58-year-old. Click on it. It's gonna want you to confirm, so you're gonna hit continue. Then it's gonna say start a live visit. You're gonna click on start a live visit. Now it's saying that you need to connect your TytoCare device before you can continue. So you're gonna come over here. This is the TytoCare device. There is a button on the top. You're going to hold that down until it turns on. Just like so. Okay. This says select patient in app, but it has that broken red paper clip. Okay? See that broken red paper clip?
No,
That
it
tells.
disabled.
Oh, so it found it.
Oh, okay.
So it usually has a broken red paper clip at the top when it's not connected, and if it found it, it'll then prompt you. The following user account would like to connect to the Tyto device, nurse 3 at CPCC, which is exactly what we logged into. We're gonna hit allow, so it should connect immediately. Now it's connected. Now we have to choose our clinic. Our clinic is going to be CPCC, okay? This next screen here, because this is in schools, you can invite parents, guardians, health, we're not gonna do that, so you're just gonna hit skip. You're at the screen that you need to be now. If you notice, it popped up, a new patient was added to CPCC queue. So now we're waiting for the provider to add the patient, because, so when you're on the provider side, you're gonna come over here to where it says unassigned, click on it, add to my queue. Now this is in your queue. Once that's in your queue, you're gonna be waiting as a medical assistant for the provider to start the visit. So as the provider, you're gonna come over here, click on the patient. The provider would review all of the information about the patient and then hit start visit. Okay. Now this iPad is going off. It's saying the clinician is waiting for the patient. Doctor has already started it. You need to hit accept.
It sounds like you're getting to a movie.
Yeah, I know, right? So I went ahead and turned this off because we're gonna get feedback and it's gonna like screech. Yeah. So you're gonna hit join as the medical assistant. Okay? And
I would be in killing.
do you guys see the provider on
Yeah.
the left? Okay.
Hi, how are you?
All right, so now I'm gonna need a patient to come up here. And I'm gonna turn that off. Put this back a little bit. You'll need a chair, so if you wanna roll a chair over here, and you're gonna face the camera.
Oh, yeah. Funny.
All right, I'm just gonna grab a popsicle stick, I forgot. Now, the provider has their scenario card, and the provider is going to dictate where you start. So, as the medical assistant, I'm gonna be on the provider's end, hearing everything. So, as a medical assistant, you're going to phone, and then you're going to make sure I see it in the camera and say, just like that, or not say anything, so I can see that you phoned your hands. And then you're gonna introduce yourself. My name is so-and-so, I'm gonna be blah, blah, blah. Can I please get your first and last name, spelling, and date of birth, please?
Pink Princess, P-I-N-K,
Okay, and then you're gonna put gloves on. And then let the provider know, all right, we're ready for you, provider. The provider's gonna say, all right, let's go ahead and start with heart rate, okay? So the provider is gonna come over here and click on heart rate. And then as the medical assistant, you're gonna come over here and put on the correct extension. So this has a little blue dot, and then this has a little blue dot on it, okay? These just have to match up. Snaps on just like so, okay? Once it's on, it's gonna recognize it's on, and now we need to make sure that where it says BPM, that an actual heart rate shows up. And you're gonna place it right where it tells you to in the diagram. That diagram is also on this little screen, okay? Okay, are you ready?
Yeah.
Yeah, my voice is echoing.
Oh, okay.
All right, 1, 2, 3. And you have to apply a good amount of pressure and just wait. And the pressure has to be consistent, okay? You can't move or change. Yeah, no, you can breathe. Am I pressing too hard? Did it come up?
Mm-hmm.
Oh, y'all should have said something.
Oh.
So, it doesn't show on your screen, but it will show on the doctor's end.
Oh.
So then the doctor would say, all right, 85 beats per minute, we're good. Now we're gonna move on to breath sounds, front and back. So the extension for that is gonna be for the lungs, and it doesn't change for
Wait,
breath
get it
sounds.
again, get like you just.
It's, yep, it's this.
Oh, wow.
So how do you know what's next?
Scenario card. Yep, so the doctor is gonna tell you what's next. So breath, you're gonna hit lungs. And then it says on here, front and back. It might say back and front, so you start with the back. So all I'm looking is that you pick one. So we'll do 2 on front. So the doctor will say, we're gonna start at position 2 on the front. And they're gonna tell you that through the iPad. And it'll show you on the screen on this device as well. But the doctor has to click it for it to change.
Okay.
So you're gonna put it right in line with whatever the screen says, like it positions it for you, okay? And then you just listen to the heart. Okay? And then the doctor's gonna, yeah, because it's really low. You'll have to be standing right here to be able to hear it.
Oh.
And then the doctor's gonna say, all right, we're gonna move to the back, and we'll do position 3 So then you're gonna come to the back, look at position 3, so it's gonna be right here. If you don't mind, bend it over forward a little bit. Okay. All right, good. Now we're gonna move on to ears, okay? So then the doctor would come over here and click ear.
This is gonna be so satisfying having sessions with ears. Tell me if my ears are clean.
Okay. You're gonna be able to see it for yourself. And this is the otoscope for the ear, okay?
How do you clean it?
I'll show you.
Oh, okay.
So, blue dot, click it in. You do not use it like this. You need to put a speculum on it,
Gotcha.
okay? Since this school is funded by the state, we don't really get ones that actually work with this. So, we're gonna take the speculum and you're gonna have to hold it on there or it will fall.
That's why
Okay.
you said that.
Yes, because apparently the ones for this are too expensive. So you're gonna take whatever we have, you're just gonna hold it on there, okay? Next, you're gonna see, so the doctor's gonna say, okay, we're gonna do both ears, and then the doctor will tell you which one we're gonna start with, left or right. So we'll start with right. Then the doctor has to hit start exam. Once the exam has started, we can begin.
Oh my God, yes.
All right. So we're gonna pull your ear up and back. And now we need to look for the eardrum.
Ew, is that what
We
it
need
looks
to
like?
see that gray, shiny eardrum. The doctor's gonna say, perfect. Now we can move to the left ear.
And you don't wanna be the doctor, right?
Nope, you guys are. Because you guys have to know what the doctor is doing.
Oh.
Because there are some doctors that don't pay attention in the training and you have to guide them. So, and then it also helps you know when the doctor has clicked on to the next thing. So we're gonna hit start exam and now we're gonna move to the left ear.
That's what your eardrum looks like.
Yep. So pull up and back. Here we go. Beautiful eardrum.
Oh my gosh. Wait, keep doing it. Sorry, it's very satisfying.
And you could buy these devices at your local
What is
CVS
that
or whatever.
right there?
For me too.
Is that just my ear?
I think that's just ear canal. So yes, they do sell them and you can just buy them over the counter.
How much are they? For sure.
They're expensive.
Yeah, I know.
But yeah. So, all right. So then the doctor is gonna say we're all done. This would go in the
It's not an ear,
biohazard.
there's just an ear.
The doctor would say,
Temperature.
all right, now we're gonna listen to heart sounds.
Oh,
So now we're gonna go to the heart.
so now I take that off again.
Take this off.
I thought we did heart already.
No, we did heart rate.
Oh, okay.
Yep.
Wait.
So heart rate is there and this is heart.
Okay.
So it's the same extension.
Oh, you
We're
already
gonna
took it off.
snap that on. Okay. Now for the heart, it's just like the lungs. The doctor is gonna say, except we only have the front part, we don't have a back. And the doctor would say, all right, we'll keep it at 1. Okay? So we're gonna come over here.
Right.
And the
it's the
doctor will
opposite.
say, all right, we're gonna go ahead and do 4. So this is the apex of the heart. If you wanna straighten your back out, yep, just like so. Okay. And then the doctor will say, all right, all done. Now we can move to the throat.
Oh, okay.
So you would put this, take this off. The doctor will move the throat. We'll take this extension. This is the one for the throat. Click that on. You're gonna put this down for a second because you need to prep the tongue depressor. We're gonna just split it in half. Okay? We're gonna take this side and slip it right in,
That's pretty cool.
just like so. And now you have a tongue depressor, okay? That's okay. All right, we're gonna make sure that's on well. So, some of us have a pretty bad gag reflex. I'm one of those. So first, you're gonna coach your patient, make sure that, you know, they understand what you expect of them. I do require to see the eardrums for the ear and the back of the throat, okay? So you need to learn, this is, you know, it takes two to make it work. So you're gonna need to press that tongue down, okay? But you don't need to be in there forever, okay? Check your patient. So, all right, patient, so what I'm gonna need you to do is open your mouth wide, stick your tongue all the way out and say, ah. Can you do that for me now? Great, just like that. So you can go ahead and close your mouth. You can swallow your spit and all that.
I did, sorry.
Oh, okay, no, it's okay. And now we're gonna go ahead and begin. Are you ready?
Yes.
Okay, open your mouth and beautiful.
Oh my god, my mouth is beautiful.
Just-
Sorry, I didn't scare
Just
you.
like that. Okay, then the doctor is gonna say, all right, great, you're gonna take this, put this in biohazard, remove this. Oops, I hit the off button. And then the doctor's gonna say, all right, now we're gonna move to temperature. So for temperature, there is no extension. You're just going to use it bare. With every temperature, you have to calibrate it before you take the temperature. And when you calibrate it, it has to be on an inside wall. So inside wall meaning if there's a wall that connects to windows, you can't use it.
Okay.
Can I use this wall?
No.
No, because it's connected to that. So this is the wall I'm gonna need to use, okay? So, the doctor will say, I'm ready to calibrate. No, I need the wall, not you.
Oh!
Patient, please have a seat. I will be right with you,
I'm
okay?
sorry.
I know you're super excited. Just give me one moment. I'm just going to make sure my machine works, okay?
I got you.
All right, so the doctor is gonna say, okay, I'm ready to calibrate. Doctor's gonna hit calibrate, and then doctor's gonna say, starting now. And then you're gonna come to an inside wall, 2 to 3 inches away from the wall. It's gonna say waiting, and it has a timer on your end, 3, 2, 1, 73.5. Looks like it's good. Now the doctor's gonna say, all right, I'm ready to start the exam. So you're gonna click on, they're gonna click start exam. 2 to 3 inches, 3, 2, 1. Making sure you hold it still. Oh, I moved. Hold on. It's very sensitive. 3, 2, 1. There we go.
Wait, how do you-
97.9.
What if you have a shaky hand?
So you're gonna have to remain it still. Like if you want to use your other hand to kind of keep it stable, you can. But 2 to 3 inches away, it is not stuck to the patient's forehead.
Is it counting? That's what you said?
Yes,
Okay.
it'll have a timer on here, say 3, 2, 1. So, doctor will say, all right, we're all done with temperature. Lastly, skin. Skin is the same thing, no attachment. You're just gonna, may I see your arm, please? You'll say, okay, maybe we can find like a mole or something.
I do have one.
Oh, perfect. And then you'll just kind of look at it, and then the doctor will hit the focus button on their end, and it'll make that picture more clear.
Do one on my face too.
Okay?
I have one on my face.
Okay?
Yeah.
Just like so. And then the doctor will say, all right, I'm all done here. Does the patient have any questions? No. Doctor will end the visit, complete visit. Doctor's done. Now, I'm gonna come around when you turn everything off to see you finish the visit with the patient. So then I'll tell the patient, all right, so it looks like that we are all done. Did you have any questions for the provider?
No.
Okay, so I'm gonna go ahead and clean everything up and then I'm gonna walk you out, okay?
Okay.
So you're gonna take your alcohol swab. These are the only things that are, that we can use to clean off all the extensions and the equipment because the table ones will eat through it. So we can't use those. Yeah. And then you're just gonna make sure all the extensions are cleaned appropriately, just like so.
What about the documentation?
There's no documentation for this.
What?
Yes, it's the easiest comp you have in this whole
Yeah.
class. And then you're going to turn your TytoCare device off by pressing the button once and hit the button that says shut down and hit shut down. And then you're gonna wipe off the front. Put that here. You're gonna come over here. You're gonna log out of your iPad. Yes. And just give that a quick
Oh, really?
wipe, just like so. Okay?
Isn't it?
Once you're done, you're gonna remove your gloves, foam, and then you guys are gonna rotate positions. Okay? And then the doctor would also log out on their end.